Are you suffering from joint pain or arthritis? Are pain medications causing major side effects or are no longer effective? Have you been told that your only remaining option is joint replacement, or worse yet, that your underlying medical conditions prohibit your doctor from safely performing the surgery? Questions like these are not some hypothetical or theoretical exercise. Millions of Americans are facing these very difficult situations. The following video is designed to introduce you to regenerative medicine and inform you regarding some of the new exciting options that are currently available and are on the near horizon in the world of regenerative medicine. I hope you find this video instructive. After watching this video, if you need more information or if you feel that you may benefit from these procedures, please contact one of our specialized representatives who can further assist you. Welcome to the exciting world of regenerative medicine. At its core, regenerative medicine means using your own body's healing power to repair structures that may have been damaged through aging, chronic inflammation, or trauma. One of the most common applications of this therapy is in the field of arthritis of joints, such as your knee, hip, shoulder, as well as wrist and fingers. Now look at this typical arthritic knee, where the inner part of the knee joint has been completely damaged, resulting in the thigh bone that is rubbing against the leg bone, commonly referred to as bone-on-bone configuration. A typical patient in this condition would live with severe pain and disability, eventually requiring joint replacement, as shown in this X-ray image. In this picture of pelvis and hips, we see similar severe arthritis of both hip joints, once again showing bone-on-bone configuration, eventually requiring hip replacement. Another common area of arthritis is in the joints of the hand, especially at the base of the thumb, as seen in this X-ray image. In the shoulder joints, regenerative medicine has shown significant benefits, both for arthritis as well as tendinopathy, such as rotator cuff issues. Compare the damaged joint on your left with the normal joint on the right. In these diagrams of the shoulder, a typical rotator cuff tear involving the supraspinatus tendon is illustrated. Plantar fasciitis is another condition in which regenerative medicine has shown significant benefits. Heel pain is a common affliction, which generally resolve with conservative therapy including rest, stretching, orthotics, and local injections. However, many patients suffer from recurrent or refractory heel pain unresponsive to these measures. Regenerative therapy has shown excellent results for these patients. Beneficial applications of regenerative medicine are expanding continuously, including bone and muscle injuries, degenerative disc disease, as well as to the cosmetic fields such as hair restoration and skin rejuvenation. Currently, there are two main therapeutic options: platelet-rich plasma, also known as PRP, and stem cells. Platelets are cells in your blood, and they constitute one of the main components of your blood, along with your red blood cells and white blood cells. Their main function is to assist in clotting of your blood to prevent blood loss and exsanguination, as in tissue injury during a major trauma. However, research has shown that platelets also contain high density of growth factors and cytokines, which are essential in healing and repairing of damaged tissue. It is believed that this factor is responsible for the beneficial effect of PRP injections. PRP is obtained by centrifuging or spinning your own blood and separating the component layers. The liquid layer rich in platelets, called the buffy coat, is then extracted and injected back into your joint or your tendon or ligaments. This beneficial effect of PRP has been known since the 1950s, and PRP injections continue to increase in popularity, especially among professional and high-performance athletes. Another therapeutic option is stem cell injections. There are four main types of stem cells: embryonic, induced, perinatal, and adult stem cells. Embryonic stem cells are derived from fertilized human embryo, approximately 3 to 5 days old. However, due to the ethical concerns, these cells are usually obtained from excess fertilized eggs resulting from in vitro fertilization. These cells are truly pluripotent, meaning they have the potential to develop into any other cells. However, these cells are used for research purpose only, and they are not in clinical use. A second type of stem cells are called induced stem cells. As the name implies, these are adult cells that have been genetically induced to behave like stem cells. These cells are also for research purpose only, and they are not in clinical use. A third stem cell type is called perinatal. These cells are obtained either from amniotic fluid obtained during amniocentesis or from umbilical cords after delivery. These cells are being used clinically. The fourth and the most widely used stem cell type is called adult stem cells, extracted either from your fat or the bone marrow. Fat stem cells are obtained by surgical resection or liposuction of your own fat and dissolving the fat tissue surrounding the matrix called mesenchymal tissue, which contain the stem cells. It is more invasive and requires overnight plating and incubation of the stem cells to grow them. The most important difference from the bone marrow procedure is that the fat is dissolved using chemical manipulation. It is for this reason that the FDA does not consider this procedure to be truly your own cells or autologous. The bone marrow stem cell procedure, however, does not require any chemical treatment. It is obtained from your own pelvic bone, which has been shown to contain the highest concentration of unmanipulated stem cells. Since the procedure only requires simple centrifuge or spinning, the FDA considers the stem cells obtained from the bone marrow to be truly autologous or your own. For this reason, ADR's Center for Healing and Regeneration only uses bone marrow stem cells. Regenerative therapies are now being offered at many of the world's famous institutions, such as Cleveland Clinics, Mayo Clinics, and Stanford University. In the following video, Dr. Shane Shapiro, the Medical Director of Regenerative Medicine Therapeutic Program at Mayo Clinic in Jacksonville, Florida, discusses the stem cell therapy being offered at the institution.
I'm Dr. Shane Shapiro, a physician from Mayo Clinic, Florida, Department of Orthopedic Surgery, with information about an exciting regenerative medicine clinical research trial to treat knee arthritis. Osteoarthritis, or degenerative joint disease, is a degenerative condition of joints affecting millions of patients. It causes pain and significant functional limitations with subsequent deterioration in quality of life. While we have many treatments, there is no non-surgical cure, and the condition often progresses to the point where joint replacement is required. At Mayo Clinic and the Mayo Center for Regenerative Medicine, we are studying several biologically based non-surgical treatments for osteoarthritis. One such treatment is the harvesting of a patient's own stem cells from their bone marrow. In our procedure, we draw cellular-rich bone marrow from both sides of the pelvis. We then filter the resulting product and concentrate the stem cells and their corresponding growth factors. Using an ultrasound to image the knee joint, we are then able to precisely inject the cells into the arthritic knee. We are currently demonstrating that this procedure is safe and can relieve pain. We also hope to be able to slow the progression of the degenerative joint disease and perhaps even one day regrow cartilage within the arthritic joint.
At ADR's Center for Healing and Regeneration, we offer both PRP and bone marrow stem cell injections. PRP is an outpatient same-day procedure, generally requiring 1 to 2 hours. There is no special pre-procedure preparations. The procedure itself requires a simple blood draw of approximately 60 cc's. Once the PRP layer is separated using centrifuge, it is then injected back into your joint or tendon using precision fluoroscopic targeted guidance. Compared to other centers, ADR's charges have been shown to be significantly lower. As with PRP, stem cell injection is also an outpatient same-day procedure. However, unlike PRP, stem cell therapy does require a light IV sedation. Approximately 60 cc's of bone marrow aspirate is obtained from your pelvic bone through a needle. Once the stem cell-rich layer is separated using centrifuge, it is then injected back into your joint or tendon using precision fluoroscopic targeted guidance. As with PRP, ADR stem cell charges have been shown to be substantially lower than other comparable centers. For more information, please visit our website at www.adronline.org/healing. You can find patient testimonials as well as links to expert presentations and additional helpful information. Stop living with pain. Start your healing today and get back into your active life.